friends, Dr. April Kern here at Smiles at Reston Town Center. Today we're going to talk about things your dentist can tell about you just from looking at your mouth. The first thing that we can always tell is that if the first time that you flossed since your last checkup was right before this appointment or not. So if we look in your mouth and your gums just instantly start bleeding, we know that something's up and you might not be flossing regularly at home. And the next thing we can tell, most dentists can actually tell if you snore at night. So if you do snore, we can usually tell by your tongue. There'll be like perfect imprints of your teeth in the side of your tongue. And that's because if you're not getting enough oxygen whenever you're sleeping, you actively like push your tongue up against the side of your teeth. So if you have these like scallopy looks to the edges of your tongue, that may mean that you are snoring. The other thing we can tell is if you sucked your thumb as a child, and if you did, you may have something called anterior open bite, which means your front teeth are open in the front. And remember, it's never too late to get that fixed as an adult. You can also tell if you're pregnant. No, we're not mind readers. No, you don't look fat. It's because whenever you're pregnant, there's many things that happen to our bodies that are unpleasant, and one of them is that your gums start to get puffy, and so we even call it like pregnancy gingivitis. So if your gums are just puffy and red and swollen and never were whenever you're not pregnant, that means that you could be pregnant, and we can usually tell. Dentists can also tell if you have a nail biting habit because you can see the signs of it on your teeth. So if we're like kind of looking at your hands a little bit, we're checking to see like if your nails like bit, if you're nervous, if you have dental anxiety or not. The other thing that I talk to my patients all the time about is a dentist can tell if you have acid reflux, and a lot of times it can be undiagnosed and your doctor doesn't even know that you have it, but we can see signs of that acid erosion in your mouth. Dentists can also tell if you have a sinus infection. So a lot of my patients come in saying, I have a toothache. They're always pointing to like one of their upper molars. And if there's nothing wrong with your teeth, one of my general tests is lean over and pick something out from the floor. Does it hurt worse? Then you probably have a sinus infection. So a lot of times we can actually help diagnose a sinus infection. Similarly, we can also tell if you have an ear infection. Same thing, come in with pain, maybe even like numbness in your face and in your jaw, and nothing's wrong with your teeth. It could be because your facial nerve is really close to your ear, and any inflammation along your ear can actually cause some numbness, which is really interesting. Don't see that too often, but we have. We can also tell if you have a metabolic disease like diabetes. You'll be more prone to gum disease, and you like have delayed healing. Remember that gum disease actually causes diabetes too. We can tell if you have autoimmune disease, see some mouth sores. You could have like swollen and bleeding gums even though you don't have very much like tartar buildup. So we might refer you to like your primary care physician for like some blood tests and testing. We can tell if you have a drinking problem. So if you drink too much, right? If you come in like alcoholics will have like a lot of cavities. You have a really dry mouth. And it increases your chance for cavities, of course, like my other videos I talked about. It's that acid in the drinks and the acid that causes cavities. We can also tell if you have oral cancer. Again, refer to my other video about the importance of an oral cancer screening. And we can also tell if you love eating candy and sweets and having sodas. This is classic because we can tell how many cavities you have. All right, so the takeaway is I can tell a lot about you during your exam, so don't try to trick me. But honestly, just come in if it's been a while. There's no shame and no judgment in anything. All right, thanks for watching. See you soon.